warm welcome to you from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation, and today with Dr. Kyla Hayford from the International Vaccine Access Center. Welcome, Kyla.
Thank you.
So today we're actually talking about a special event that's coming up on Friday, which is going to be a comprehensive presentation of Serosurveys for vaccine-preventable diseases in the era of COVID-19. And if you have not registered for this event yet, you have 2 days and less than 2 hours to do so, and we certainly hope you'll join us. We also know that immunization professionals are especially busy right now, and so we wanted to try to give you, in a 15-minute, what we're calling a lightning chat, really the opportunity to meet Kyla Hayford, who will be one of the panelists on Friday, and to get some basic information about what are serosurveys and why and how they are relevant, or especially relevant, for vaccine-preventable diseases during the pandemic. So let's start there, Kyla, and we'll be looking for your questions. So if we're looking at your comments. So if you have comments, do share them. We are keeping an eye on them. And I see that, for example, Mohammed Ahmed Adan had a reminder set waiting. So I'm hoping, Ahmed, that you are online with us right now, as well as Akini Marigoretti. And please let us know which city and country you are connecting from by typing into the comments. That's exactly in the same way that you will share with us your questions for Dr. Kyla Hayford. So let's start at the beginning. What is a serosurvey?
Thanks, Reda, and thanks everyone who's on the call. A serosurvey is essentially a conventional survey, but we add collecting a specimen, usually finger prick or blood from the vein, to monitor antibodies to a set of vaccine-preventable diseases in this case. So in particular, we look at measles or rubella, and what it tells us is those antibodies are indicators of whether someone has been exposed to that virus. And it's very important for us to understand exposure in terms of either to the virus, to the disease, or to the vaccine, to understand who is susceptible and who is immune to measles and rubella. So it's a really good tool to directly measure population immunity in a country, in a region, or in a specific area where you have questions or interest.
Great, thank you, Kyla. So a greeting from Tete Boadu Michael from Ghana Eastern region. So welcome to you, Michael, and we're looking forward to your questions. So please don't be shy. And if you have questions for Kyla Hayford, if you have been involved, whether or not you have heard of serosurveys before, whether or not you have been involved in a serosurvey, if you'd like to share. We also have online with us Hervé Mutoto from Kinshasa in the Democratic Republic of Congo. So welcome to you, Hervé. Looking forward to your questions. Halima Toro connecting from Abuja, Nigeria as well. So welcome to all. Whether or not you are already scholars, we hope that you have already registered for Friday's comprehensive event. Before we go further about serosurveys, Kyla, could you tell us about the panel on Friday? So why is that event on Friday especially worth attending? There seems to be a super interesting group of people with amazing experience and expertise in serosurveys. Can you tell me a little bit about who they are?
Yes. So there'll be 4 people, including myself. So I work at the International Vaccine Access Center at Johns Hopkins University, and I've spent my career working on serosurveys, primarily in low and middle income countries. There's a lot of experience doing serosurveys in high income countries, but the utility we see is throughout the world in expanding this so that people can understand immunity to vaccine-preventable diseases. Felicity Cutts will be a panelist. She has a career and an exceptional knowledge base on the use of serosurveys for vaccine-preventable diseases and how they are useful to the immunization programs. Carolina Donavarro Holiday, she is from the WHO headquarters and works in the EPI program and understands the important linkage between vaccination programs and revealing immunity. And then lastly, Simon Mutembo, one of my colleagues at Johns Hopkins, he comes from the Ministry of Health in Zambia, and he currently works as a researcher on the Serosurvey throughout Zambia, where we're really doing a focused work. So he has a lot of field experience and knowledge about how to work with the governments to make sure the messages reach the key people from Serosurveys.
Great, thank you, Kyla. I want to greet Green Sadru from Tanzania back, one of a longtime scholar who I'm very pleased to see is joining us for this lightning chat. So just for those of you who've just joined, this is 15 minutes ahead of an event on Friday. So if you haven't registered yet for this event, please do so now. And we have with us Dr. Kyla Hayford, who's been answering already our questions. And the recording will be instantly available. So if you're joining sort of midway, you can always go back and watch the beginning right afterwards. So let's see. We have Charlotte Cabin from Eboloa in Cameroon. Greetings to you, Charlotte. She's actually a member of the Geneva Learning Foundation team. Izuogo Promise from Nigeria is joining us. So Izuogo, I hope you'll be with us on Friday. And Luc Kabunda from the DRC, from the Democratic Republic of Congo. Yes, glad to meet you again as well. Unless he's, can you tell us if Kyla Hayford, have you worked with Luc in?
I have not yet worked with Luc, but Luc comes from and several other people from places where there have been exceptional serosurveys done for vaccine-preventable diseases. They are the best examples. DRC, Nigeria, Zambia. So great to see you.
All right, great. And thank you for joining us. We'd love to hear more, and we definitely will on Friday. We may have a couple of minutes to hear about at least one of the serosurveys. Greetings as well to Taimur Kayani from Pakistan, and to Dipesh Shrestha from Nepal. Wonderful to have you all online with us, and we're talking with Dr. Kyla Hayford from the International Vaccine Access Center at Johns Hopkins, who will be one of the panelists with us on Friday to talk about serosurveys. So now let's get back down to specifics. So you've told us what is a serosurvey. What can you learn from a serosurvey that you cannot? And we're especially interested in what you can learn from serosurveys that you cannot learn through other survey methodologies.
So the most important thing is that we can reveal patterns of immunity that otherwise you can't know unless you have extremely rigorous monitoring of outbreaks as well as rigorous monitoring of vaccination coverage. And still, it's very difficult to know who is susceptible and who is immune. And unfortunately, the only other way we learn that is when there's a large-scale outbreak to measles or rubella or other diseases, and then we discover who is susceptible. But a serosurvey allows you to identify populations that are susceptible before an outbreak can occur, and so at a time when you can act.
Great, thanks. And now, what is it during the pandemic? How have serosurveys all of a sudden become potentially much more relevant and important than they might have been before?
This is a very good question and a complicated question. So just at a very high level, we recognize that there will be more serosurveys going on in the next year for SARS-CoV-2 than there ever have been in the past. Right now, SARS-CoV-2 is not a vaccine-preventable disease yet. And so then there's still a lot of questions about how to do a serosurvey and what they mean for COVID-19. We have a profound amount of experience looking at vaccine-preventable disease serosurveys, and a lot of those learnings, how you do them, where you do them, why you do them, are directly applicable to SARS-CoV-2 serosurveys. But also, we know the pandemic has disrupted and affected immunization programs. And this is an important opportunity to potentially directly measure gaps in immunity as after the pandemic or further on in the pandemic to ensure that the programs for immunization are reaching the populations that they need to be and who potentially who are at risk.
So I won't name any names, but I was speaking with the very senior immunization professional with decades of experience, and sort of brushed it off and said, serosurveys are too expensive, too complicated. What is your response to that? Is that a legitimate concern about the level of complexity and the costs? How do you respond to that? Where and how, can you challenge that?
Yeah, It is a very real concern. So yes, serosurveys can be expensive. One of the things we've learned, though, is that the cost of doing the survey, not the serosurvey, just getting out to do the survey is expensive. And adding the blood collection on does add an increased cost, but it's not as much as you might think. We're trying to better clarify how much things cost and how you can save money. But I think the really important question is, how much is it worth? How much is that information worth to you? And can we find better ways to reduce the cost, target the activities so that we can gather the information more efficiently and at a lower cost?
Thank you, Kyla. And I just want to acknowledge and greet, we don't have time to greet everyone, but certainly Francis Abema, Rajat Garg, Maimun Abdullah, Mariam Bello. I haven't seen any questions yet, so I'm guessing that's because people are first trying to understand what are these serosurveys. But please, and on Friday, again, we're having what we're calling a lightning chat. So 15 minutes with Dr. Kyla Hayford, one of the panelists who will be on Friday, and we'll be broadcasting this on Facebook Live as well. And so if you haven't registered yet, make sure you go to the Geneva Learning Foundation website. We'll be posting the link in the comments in a few minutes. We've got 4 minutes left to talk with Kyla. And then join us on Friday. If you miss it, of course, the recording will be available. But if you have questions or experience with serosurveys to share, we definitely very much want you to be, so it's better to experience that live. So, Kyla, let's finish by talking about the event on Friday for participants who had never heard of serosurveys before. If they're immunization professionals trying to work through the pandemic, trying to maintain immunization services, why should they attend on Friday? What will they learn from Friday's event?
The event is targeted at people at different levels. So there might be people who are going to see results from serosurveys, and we want to make sure that you understand how it's useful and when it's not. What are the caveats? What are the potential benefits of it? There may be people who are planning to do serosurveys, either for SARS-CoV-2 or vaccine-preventable diseases. We want to guide you on any questions you have about how best to do them, what specimens you should be using, why would I do this, how do I set it up, and then mostly we want to show encourage that the results that you can get from a serosurvey, how they can be useful to the EPI program, how they can be useful to the populations that you're surveying to strengthen the immunization programs and any gaps there are in it.
Great. So thank you, Rajat Gargi. We have our first question. So can we add data regarding VPD surveillance during serosurveys?
Can we, Rajat? Can we add VPD data, meaning for the disease?
All right, let's see if he can clarify. There is about a 10-second delay between with the broadcast, so let's go back to that question. I had hoped you could decode it. And knowing Rajat is another experienced scholar, I know he must have something very specific related to his work that he is doing. So Rajat, we'll go back. And greetings to you, Ismail Moomen. So you said that this was for a broad, a fairly broad set of people that we're trying to address through this sort of public-facing event. What about people who actually have contributed, participated, maybe even designed and managed serosurveys? Are they welcome, and will there be an opportunity for them to share their experience on Friday?
Absolutely. So, Rita, an important piece is that there's this community around the world of people doing serosurveys and the complexities of doing them. It's important to do them well, and many of you have experiences about the challenges and of them and how to do them well. So we do want to hear from you about everything from how you have set them up, why you chose with the specimen you chose, how you've overcome some of the challenges to generate high quality results.
Great. All right. So The date is set for Friday, so I'm going to show it on screen again. Serosurveys for vaccine-preventable diseases in the era of COVID-19. So this is the time shown is Geneva time. You can Google Geneva time to figure out what time it is where you are. We do have one last comment from Taimur Kayani. Serology is performed for confirmed polio cases in Pakistan, but as a serosurvey, would love to hear from you people. Would be a great learning experience. Thank you for that comment, Taimur. We're out of time. This is what we call a lightning chat, and we mean it. Thank you so much, Dr. Kyla Hayford from the International Vaccine Access Center at Johns Hopkins School of Public Health. We'll see you Friday. Thank you.